So the over test, we want to maximally lengthen the iliotibial band. I am going to push up on the iliac crest, okay? And then I'm going to let her leg, I'm starting with her leg in slight abduction, and I'm letting her leg fall. Now, why does having the knee bent lengthen the iliotibial band? So it's actually, if we put the axis here, it crosses in front of the axis of the knee. And so to lengthen it, I need modified over. I'm really pushing hard up against her iliac crest. I have her leg up slightly, and I'm passively lowering it. And my elbow just dislocated. I'm dropping it, and she has normal length because I'm able to get it below neutral. Did you hear it? Oh. What are you doing to me, Madeline Ray? Okay, so then the modified over is actually with the knee straight. And now I can't press anymore because of my elbow, but I would be stabilizing here, and I would be lowering her leg down this way. Now, in theory, we are not having the iliotibial band lengthen at the knee joint when we do the modified version. And so it would be that if the TFL itself was tight, we would still see continued tightness, and that leg wouldn't be able to drop with the knee straight. So trying to differentiate between the TFL tightness versus iliotibial band tightness. If it was the iliotibial band, I would be able to lower her leg further with her knee straight than with her knee bent. Okay? So the big thing is that you need to really be cranking on that pelvis to not let that pelvis drop. Because if I just did it this way and didn't hold on, well then her pelvis can just come with me, right? And then I would get a false negative. So you do have to make sure that that's up. Okay?
So she gets a neutral, it's a negative test then?
Exactly.
The other thing you guys want to notice when she's doing that is her body mechanics and how she's using her body to stabilize her pelvis from rotating back or forth, posterior anteriorly, so that you're not standing away and moving the leg. You're using your whole body for your purposes, but also to keep the patient in a stabilized position. Some of you guys are not doing that when we're practicing, so use your body to stabilize as well.
Okay. Motion is just having her actively take her knee to her chest. Okay. So the first muscle that we're going to test is your iliopsoas, which is a big muscle that attaches to your back and comes along and attaches to your hip. Okay. So what I would like you to do is I'd like you to bring your foot out towards me a bit, and then rotate your toe out towards me, and now you're going to lift your leg up until it hits my hand. Great. Now I want you to hold it there, and you're already starting to cheat. Hold it there and don't let me push it down. And relax. Good. So how she started to cheat is as soon as she got her leg up, this hip came up. Okay? So I'm monitoring to make sure that she's staying in with hip flexion. Now I'm using a really long lever arm because her hip flexors are going to be stronger than my arm, puny arm muscles. If you were worried about the integrity of the knee, you may not want to apply resistance across the knee, so you might apply it here. You're going to have a hard time assessing strength with that shorter lever arm because the hip flexors are, generally hip flexors are going to be short and tight. So it's not generally a problem that you're going to have hip flexors that are weak. Okay? For the tensor fasciae lata, which is another one of our hip flexors, there you go. And lift it on up just like you did before. Hold it there, and I'm going to try to push it down, and don't let me. Okay. And relax. So that was silly to do a frog leg for me. So you're going to come up like this. Good. Come back down a bit. There you go, right here. So I have her go through the full range of motion. I have you here. Now I'm going to try to push you down and pull you out all at the same time.
Okay.
Don't think about all of that. Just don't let me move your leg.
Okay.
Okay? Are you ready?
Yep.
And relax. Good. Okay?
Would you have stabilization of the opposite hip or not by that helper?
You can't because you are applying resistance in two places.
But could you have a helper for that or not?
Don't
You don't
know
need it.
how you do that, but what you're going to do is, are you having fun with your slippery socks? I'm going to hold the top leg up. I'm going to want you to straighten this bottom leg for me. I'm going to have you bring it back just a bit. Okay. We'll see if I can do it. Okay, so I have her here. Now what I'd like you to do is bring this leg up towards me. Can you come on up in here? This leg? Come on. No, just kidding. Hold it there. Don't let me push it down. It's really hard. And relax. So what you don't want to let the person do is flex their hip, because then they're trying to recruit their hip flexors in doing it. So you really want to keep that leg the same. Okay. Obviously, gravity eliminated would then just be in supine. All right. So that's how you're testing the adductors as a group. Bottom leg. Okay. So for gluteus minimus, you're going to have the foot staying flat to the table.
Okay.
Okay. And let's have you lift your leg up as high as you can towards the ceiling, keeping your foot flat like that all the way up. There you go. And come on back down. So that's our full available range of motion. Now remember, hip abduction was one of the ones that we said, if she can't abduct her leg, we need to check the trunk lateral flexors. Right? So we talked about the hip compensations and the back compensations and that combination. The hip abductors was one of those muscles that if she can't lift up her leg, but I see these two collapsing, that might be an issue of strength here and not an issue of strength here. So you definitely need to be aware of that. So I'm going to have you go ahead and bring your leg back up again. Now I'm going to push it straight down and you don't let me, okay? Now you do have a little bit, and relax. I am resisting a little bit into, I'm pushing her into flexion. She's resisting a little bit of extension. Okay? Now, don't rotate the rest of your body, just your foot. Not a lot of hip rotation for you. Okay, go back up towards the ceiling. Same pressure, okay? Hold it there, don't let me push it down. And relax. Good. All right. For gluteus, we have glute max and we have hamstrings that are going to be our hip extensors. How do we get the hamstrings out of there? Flex the knee. So go ahead and bend your knee up. So what I'm going to have you do is lift your leg up off the table. Great. And go ahead and go back down. So that's my full available range against gravity. Again, this is one of those muscles where if she can't lift her leg, I need to watch what's happening in the back. Because it may be a weak back extensors and not a problem with her glute max. So go ahead and lift up for me again. Okay, and I'm going to push down. Don't let me move your leg. And relax. I don't like my wrist position because I was pretty at my end range of flexion. So I would have been better off having my hand here so that my wrist was really bent. And I don't want to apply force with my wrist that far bent. So you'd want to have either come down this way and press or just bring my hand over. Okay? Now, you're going to have your upper body right where everyone's shoes have been. So go ahead. You're going to be like this. All the way down. Yeah. Okay? Scoot up on the table a bit more so that really, there you go. Okay, now I want you to take this leg with your knee bent and bring it up to the ceiling. There you go. Hold it there. Don't let me push it down. What? Crap. And your legs. Okay. Well, the table should be stabilizing your upper body. So this would be a test that you would do if someone had tight hip flexors. You certainly didn't like that test.
No, I didn't.
Okay, so that's the modified glute max. I think that was the last one. Okay, so we've got